Hello, my name is Dr. Scott, and I'm Chief of Forensic Psychiatry at the University of California, Davis. I've had the pleasure and honor of working with the California Department of State Hospitals since 1998, so I would invite you to join this wonderful organization as well. Why should you want to come work for the California Department of State Hospitals? Well, they have an amazing array and diversity of patients throughout the state. They have a commitment to academic excellence, and that's provided through the trainings that they give, all combined with a wonderful learning environment. So you can't beat working for the California Department of State Hospitals. I would invite you to come and apply and work for this organization. My role with the California Department of State Hospitals involves two key areas. First, it's consultation on complicated, interesting, fascinating cases that come up with a wide variety of patients we hear. So oftentimes the forensic psychiatry residents who pair with the treatment team at times, work with the team, review the records, and we come together as a team to figure out what's best in working for the patients in a consultative way. Second, my role is to help develop statewide training programs that really are the state-of-the-art assessments in the field of forensic psychiatry. These trainings range from assessment of malingering, assessment of sex offenders, violence risk assessment, and one that I'm particularly excited about is our mock trial training program that we designed for the entire state. Imagine that you have a complicated case, you're getting ready to go testify for court, and perhaps you haven't had much experience doing that. You'll have the opportunity, if you come work for the California Department of State Hospitals, to attend specialized training on presenting in court and how to testify on the individuals that you treat and serve. So those are the two big roles that I have with the California Department of State Hospitals. When people ask me why they should start their career with the California Department of State Hospitals, there are so many good reasons. First, you have a wide variety of patients, fascinating cases, in one of the largest forensic settings in the United States. Second, there is a commitment to providing academic training for the evaluations and treatment that you do. So even if you haven't done a forensic psychiatry fellowship, you're going to get the benefits of working in the forensic setting that provides you many of those same trainings you would have had you attended an accredited fellowship. Third, you have a wonderful salary and benefits package that is competitive nationally. Fourth, you've got a great living environment throughout the state. And then finally, if you really want to advance and move up in leadership positions, this is the place to do it. There are fantastic committees, leadership positions that may help decide how you treat patients, the best practice models, and you could rapidly advance if you're interested in doing so with the California Department of State Hospitals. One of the areas I'm most impressed with the California Department of State Hospitals is their commitment to having evidence-based approaches to the assessment and treatment of the clients they serve. To that end, they have collaborated with the University of California, Davis since 1998 to develop research protocols to assess and study the individuals we treat so that we can provide better assessments and treatment. As an example of just some of the research that has come out of the California Department of State Hospitals, we've published and presented on issues related to the assessment of dangerousness, rapid assessments of violence upon admission, using the classification of violence risk assessment instrument, and also the assessment of malingering and competency to stand trial. So in closing, there's so many good reasons to want to work for the California Department of State Hospitals. First, they're committed to academic excellence, and that's demonstrated by the collaboration with the University of California, Davis, so that you're providing the state-of-the-art assessments and treatment. Second, you've got a fantastic array of interesting patients and some of the most fascinating cases, quite frankly, you'll ever see. Third, you're working in an amazing living environment throughout the state that's known as California. And fourth, if you really want to advance in your career, this is the place to do it. So come join the California Department of State Hospital System. I encourage you to apply.